So, for the explanation of this mechanism, I want to talk about the deficiency of the blood circulation in lower lip artery. First of all, I will talk about the anatomy of lower lip, and I will show you the lower lip artery and other branches connected to it. The lower lip artery may be here, just under the skin border of the lower lip, or maybe a little bit lower, such as here, or even in the skin of the lip body. There may be different variation in different people, and the most common site is under the lip border. So, one main artery connects to inferior labial artery called ascending mental artery. This is an artery which is in a vertical position under skin and comes from the tip of the chin toward the lower lip artery and connects to it. We have also one transverse position of artery called transverse artery, and another artery is mental artery. Both of these arteries are connected to facial artery, which comes from the inferior mandibular border toward the nasolabial fold and goes and gives some branch to angular artery and has some branches on the nose. That I will talk about them in another video. This is a two-side position, one from here, another from here. So what will happen when you obstruct the inferior labial artery when you are injecting filler in the lower lip? Let me show you what will happen. When we inject filler in the lower lip, blood movement will be stopped. For example, this is the lower lip artery, and you inject filler here, and suddenly the tip of your needle goes into the inferior labial artery lumen, and you push some filler in it, and this obstructs the blood circulation. In other words, blood cannot move and will stop here, and blood clotting process will start. In other words, blood will start here, and this stop of blood phenomena will be transferred to vertical artery that comes from the here toward the lower lip artery and connects it. In other words, blood will stop here, mostly in vertical ascending artery. Why? Because of gravity force. We may say why blood doesn't stop in horizontal branches or mental branches. Because the most possible situation that blood may stop in an artery is mostly in a vertical aligned artery. So when blood stops in this artery, it will exit from the lumen and goes into the interstitial space around the ascending mental artery. In other words, you may see a clinical picture like this. A bruised lip, lower lip, that this darkness comes from here toward here. This shows blood stoppage has happened here, and if you do not open the blood circulation pathway, this may lead to lower lip necrosis, and ischemia, and infection, and destruction of the lower lip tissue. But if you do emergently and reopen the blood circulation, in other words, when you fade away the blood clot, or if you dissolve the injected filler by injecting hyaluronidase, blood circulation will continue to start, and this bruise and darkness will fade away after 1 or 2 days. But if you don't do anything, this darkness and bruise will continue to come from the lower lip toward the downstream, and all of this pathway will go toward the necrosis process. I will show you in my photograph, in my case. Fortunately, we managed to open this blockage, and after reopening of this blockage, this darkness was cleaned after 2 or 3 days. But why the horizontal or mental branches do not show any bruise or darkness at the first step after the lower lip occlusion? This is because of gravity force. When we occlude the lower lip artery, blood will stop here, and because of the gravity force and the weight of the blood remained in this vertical lumen, this is most possible that this blockage will be seen at the first step in the vertical pathway, and the horizontal or mental pathway get their blood from facial artery. In other words, there are alternative connections that will help them to nourish from the blood from the facial artery. If the blood is stopped in this pathway, they will get their blood from facial artery. And this will prevent any necrosis processes in this area. But here, blood is stopped because of the blood circulation stoppage here, and the blood in the ascending artery will exit the interluminal space and go to interstitial space around the ascending artery. After 2 or 3 days, you will see necrosis in this tissue. I will show you in the photograph, and we'll talk about the mechanism of necrosis expansion in this photograph.